At a time of deep division in today's society, we must come together for humanity's sake. On Can We Talk 360, we strive to stimulate an authentic conversation on issues that affect all of us in an environment of tolerance. I am Eugene Pettis, attorney and community servant. Let's discover how there is strength in our differences and an abundance of possibilities when we stand together as one humanity. Welcome to Can We Talk 360 Motivational Moment. You may recall that one of the topics that I have had podcast guests to discuss, as well as motivational moments, is dealing with healthcare disparities. It is a subject that has been studied over decades, but in truth, not enough has been done to eradicate the racial disparities in the administration of healthcare. Almost 2 years ago, I started a healthcare disparity initiative. It was the result of so many cases that I had seen as a plaintiff's lawyer representing families and individuals in the medical malpractice and wrongful death areas. While it is still the focus of my practice, I am continuing to push out the message to make us all better consumers of healthcare. In a recent review of a study pertaining to childbirth, doctors give Black women cesarean sections that are unneeded to fill operating rooms. About 30% of babies in the United States are delivered via C-section, about double the proportion deemed appropriate by the World Health Organization. Obstetricians are more likely to give Black women unnecessary cesarean sections, putting those women at higher risk for serious complications like ruptured surgical wounds. That's the conclusion of a report of nearly 1 million births at 68 hospitals in New Jersey, one of the largest studies to tackle this subject. In the new study, Dr. Query and 2 other economists analyzed the medical records of more than 993,000 women who gave birth between 2008 and 2017. The team focused on women who came to the hospital in labor, excluding those who had scheduled C-sections. Doctors give Black women unneeded C-sections to fill operating rooms, the study suggested. Healthy Black women with low risk factors were far more likely to get a C-section than white women with similar medical histories, was also a finding of the study. Even if a Black mother and a white mother with similar medical histories saw the same doctor at the same hospital, the Black mother was about 20% more likely to have a baby via C-section, the study found. They also found that overall, Black women were 25% more likely to have a C-section than white women were. Among women who arrived healthy and who had few risk factors, the gap was even larger, with Black women more than twice as likely to be given a C-section based on the capacity of the hospital's operating rooms, and it points to explanations that are not medically justified. The data on capacity of the hospital's operating rooms points to explanations that this is being done for economic reasons. It's interesting, when other women were occupying the operating rooms, in other words, the operating room was not available because they were already occupied with scheduled C-section deliveries, Black and white women had the same likelihood of being sent there for a delivery. Again, when there was no bed available for C-sections, Black and white women were treated similarly. But when there was an open bed, that's where Black women were sent 20 to 25% at a greater rate than white women. The study looked at something different than some of the previous studies, and it looked at the financial considerations. It noted there is lots of evidence that if a hospital has a CT scan or an MRI, they like to keep it busy, Dr. Query said. If you have an operating room set up to do C-sections, they like to keep that busy too. The study was novel, according to one of the participants. It followed the money. That really is the driver of so much that happens in medicine, she said. Private insurance companies typically pay about $17,000 for a C-section delivery and $11,500 for a vaginal birth. That's nearly 68% more profit in giving a C-section. Why do these racial disparities still exist? Studies have not been able to tie down a complete answer, but one of the physicians indicated that physicians may have certain beliefs about Black women, Dr. Curry said, who is a health economist at Princeton University and co-author of the study. They might not be listening to Black women as much or be more afraid that something is going to go wrong, which leads them to doing an unnecessary C-section. In the face of all this, what can be done? Let's discuss this, how to improve these statistics and make you a better obstetrical patient. One of the things you must advocate for yourself. Ask what are the alternatives to a C-section. If you're in a non-emergent situation, that is, there's no threat to your life or your baby's life, ask, why can't I try for a natural birth? These are questions that you must demand answers to. Secondly, you need to educate and prepare yourself for the delivery in advance. By that I mean, learn the risk of C-sections versus vaginal deliveries or natural deliveries. Have an understanding so if you're faced with a non-emergent situation, you'll know what to demand and what to advocate for. There are risks, as stated earlier, for the C-sections, and there are many that were not even mentioned. You need to do that research. Thirdly, have conversations with your doctor so that he or she is knowledgeable of your preference. Do not go into the OR for a delivery and you have not had conversations earlier in your pregnancy as to how you prefer for your baby to be delivered. And it's critical that you keep in mind what the state of your being is and the state of your baby. If there's an emergency, that may dictate a cesarean section to get the baby out as quickly as possible. If there's a concern about the size of the baby and whether you're going to be able to have natural birth, that may lead to a C-section. But these are questions that are predictable from the evaluations that occur during the course of your pre-delivery visits to your doctor. And as you find out things about the size of the baby or whether or not there are any undue risk that you don't want to take a chance with, that's the time to have these conversations. And in the midst of normal pregnancy and labor, you should have the right to determine what it is you want to choose as the method of your delivery. And lastly, if you have a spouse or a partner, make sure they are aware of your desires regarding the method of delivery. These are all things that you can do on your own to help minimize risk factors during the birth of your baby. These are issues, studies that show the disparity, racial disparity in the area of obstetrics and the prevalence of C-sections, more so with Black women than other populations, including white women. Know this information and use it to your benefit and those that you know. Mothers who have daughters, siblings who have sisters, on and on and on, friends, make sure that you pass this information on to them so that they can avoid having unnecessary surgery, which leaves them with subsequent risk factors that they did not have to confront. Again, thank you so much for tuning in to our motivational moment.
The law firm of Halitzer, Pettis & Schwam is a proud sponsor of the Can We Talk 360 podcast. Our firm handles medical malpractice, wrongful death, catastrophic personal injury litigation. We pride ourselves in being advocates for justice on behalf of those who have been seriously injured. For decades, we've taken the lead in making your case our priority. It's who we are. It's who we'll always be. Halitzer, Pedersen, Schwamm. Serious injuries, proven results.
Thank you for listening to today's episode of Can We Talk 360. I sincerely hope that you were inspired to seize this moment in time and take real action towards change. Remember, all change begins with a conversation. Be sure to tune in every month for more fascinating discussions and motivational food for the soul. Please share with your friends, family, and colleagues. Follow me on Facebook, Instagram, and YouTube at Can We Talk 360, and visit us on the web at www.canwetalk360.com.